Good afternoon, and thank you for joining us today. This is Jessica Counts, Sales and Events Manager with California Hotel and Lodging Association. Starting off, I'd just like to say, everyone, please take extra care of yourselves and your loved ones to stay healthy. We've all seen quite an impact, and is in our best interest to help keep everyone safe and bring some sense of normalcy to our lives and our business in the industry. I have seen some very positive stories on how hotels and companies are bringing a smile to their employees or their clients, or lending a helping hand in the community during the pandemic. And any stories that you can share, love to hear from you at service@calodging.com. Again, that's service@calodging.com. That would be wonderful. We will be recording today's presentation and posting it on our website at calodging.com, found on the coronavirus updates and resources section, along with where you can find our archive webinars relating to COVID-19 as well. So this section continues to be updated daily with a variety of resources to help you manage your business at this time. And today, during this presentation, and just a friendly reminder, if you could please submit any of your questions by typing them in the toolbox at any time throughout the hour, and we'll go ahead and answer the questions that we can at the end of the presentation. In today's presentation, 5 proven elements of a successful COVID-19 pandemic plan. We'll cover an effective pandemic plan for your property. Our partner, Patrick Hardy, is the CEO of Hydropy, one of the leading disaster management companies in hospitality, certified emergency manager, and certified risk manager. He has extensive experience working with facilities from coast to coast in the public, private, and nonprofit sectors in disaster management, from micro businesses to Fortune 500 companies. And we welcome him today. And Patrick, please go ahead and take it from here, and let's get started.
Jessica, thank you very much for having me. I really appreciate it. And thank you, everyone, for attending this afternoon. I know that we get inundated all the time with new information regarding COVID-19. This is clearly a very fluid event. It's the kind of event that is unique. In fact, I was talking to some colleagues on the East Coast who are in healthcare, and they were saying, well, this is quite a disaster. This is something we haven't really seen before. And I said, it is in one respect, in that when you work in disasters, and I've worked in hurricanes, I've worked in tornadoes, after massive earthquakes, even terrorist attacks, active shooters. I've seen all kinds of stuff. But one of the things that is the major contrast between those disasters and this one is that there's really no escaping it. There's nowhere to go that isn't directly or indirectly impacted by the COVID response. So every community, every state, even every country has in some respects had to deal with the COVID-19 response. The other thing that becomes important in regards to this disaster is I really categorize it within the 21st century as one of the 3 biggest disasters that's going to have an effect in the way in which we execute disaster response in both the public and private sectors. And those 3 events were 9/11, Hurricane Katrina, and now this. Because what it is going to do, it is going to shape overall the way your response is going to be, not only with this, not only when you go back into business, but also when you are working in other disasters as well. So one of the reasons why I sort of start by talking about that is because I want to get your framework correct in this, that the way that your response is going to be for COVID is not simply the next 6 weeks, not even the next 6 months. It's probably the next 6 years, because we really don't know very much about the long-term impacts of what the COVID-19 response is going to look like. So today, I'm going to give you kind of a framework for how to give your property a long-term view of not only dealing with COVID-19 now, but how to deal with it going forward also. So one of the things that we're going to talk about is the different elements of your plan and how those have to function. And there are primarily 5 elements. These are the 5 major things that a pandemic plan has to have. It doesn't matter whether you operate a sole independent property or whether you are a franchisor and run a few of them, or if you are a property manager and you run 20 or 30 of these or 100 properties. There are elements of pandemic plans, and I've seen this even with Fortune 500 businesses and really large-scale property management conglomerates, that they don't have adequate disaster preparedness, that there's a lot of elements that are so key to making them successful that I want to make sure that I kind of talk to you about this. So here, the way we're going to do it first is I'm going to give you a little bit of an introduction, and I'm going to give you a framework for how I want you to think about today's presentation, because there are things that I'm going to talk to you about, and then there's things that I'm not going to talk to you about, and the things that I'm not going to talk to you about are just as important as the things that I will be talking to you about. So that's the first element. And then we're going to go through the 5 elements of what your program really needs to have in order to be successful in the long run. 3 of them are regarding plans. The other 2 are regarding things that have nothing to do with disaster plans. There's one part of element 5 that has an indirect impact on planning, but the other 2 are really more actionable. So we're going to talk first about the response plan, which is what you're doing now, essentially. So dealing with the emergency as it is occurring, dealing with guests, dealing with impacts on your operations, your finances, your human resources, all those business elements that make you successful on a daily basis. Those are things we're going to talk about. But then the second element is one in which I actually, strangely enough, I very rarely see done effectively. So you may be doing element 1 really well, and as you're hearing me, you're probably saying, yeah, this is all interesting, but we're doing the response. I think we're doing fine. I think we're covering it. So if that's the case, I really want you to hear me out on element 2 for sure, because business continuity is so important, because it is more than simply the recovery of your finances. It's more than simply saying, do I have enough people to cover the shifts? Do I have enough people to handle the guests that we're dealing with? Long-run business continuity requires a lot of organization and a lot more than you would think. My father was a business continuity planner for 35 years. He worked at the University of Southern California, and then he worked at the UC system, and then with the Getty Museum. And he was in charge of large-scale, massive business continuity plans that dealt with not only recovery of the buildings, literally getting people back into the buildings, but also ensuring that we can actually continue operations in how we do things now. How do we get back to it? If we have to change the way the quote-unquote new normal is, how do we do that? Post-planning is really important. And when I talk about post-plan, that may seem very strange to you, and perhaps it is, because one of the things that is something that we had an event occur over the weekend, and something that I want to draw your attention to, because and we'll talk about it, because in this event, COVID-19 does not live on its own. This is not a singular event. This is something that is going to be occurring for a very long period of time. And I want to make sure that your plans are adapting to the way in which the tempo of the disaster response is going to occur. So in other words, even after COVID is done, what about other disasters? What if other things begin to occur? That's really what post-planning is about. Then we're going to talk about training a little bit. Training is important, and you do need to train people. Do you need to train people on your response plan? Yes, you do. You have to train them. You have to, and even though you are executing the plan now, do you still have to train people? Yes, you do, and we'll talk about what form that has to take. Then the last element is one which just may seem a little odd to you, but it really is the case. Drills and improvement. Even though we are engulfed in COVID-19 responses, do you still have to have drills regarding other disasters? Yes, you actually do. And a lot of properties I've been talking to actually told me this. They actually said they are planning on canceling a lot of the other drills that they were planning to run throughout the year, or they were going to postpone them, or their particular state is allowing them to postpone some of their fire drills because of the massive responses. That doesn't mean that you should ignore it. And then we're going to also talk about improvement, because I will tell you that as a disaster planner, I will say this to you as somebody who's been doing this a while. What we are seeing with COVID-19 is probably, in my lifetime anyway, going to be the most valuable opportunity for you to improve your disaster plans. It is the most valuable experience. But if you don't capture the lessons properly, and I'm seeing this even with really well-run property management companies, if it's not done and improved correctly, you will lose so much of this valuable information that is unlikely to occur anytime soon. And then, of course, I will answer questions at the end, and I'm happy to show you and answer any questions that you may have in this case. But I want you to, first thing I would like you to do as an introduction is I want you to take everything out of your mind about COVID-19, everything. I want you to take all the news hype you hear, everything you see on television, the people you're hearing on the radio, the podcasts, everything you're hearing. And what I want you to do is I want you to tune all that out right now. I want you to just tune it all out, because I want you to think about this differently. This particular presentation is, and what I'm going to try to do for you for the next 40 minutes or so is what I'm going to do is I'm not going to tell you how to navigate this storm on your own. I'm not going to do that. I don't know what's going to happen ahead. I don't know what's going to happen in 3 weeks. We can only guess. You know, I'm not the head of the CDC. I'm not a doctor, so I don't know any of that stuff. But what I can do is, as you're navigating the storm, I can tell you how your ship needs to be pointed. What kind of elements does your ship have to have in order to wade through this storm? Those are things that I can do for you. And I want you to think about this like it's a hurricane, like it's a tornado, like it's an earthquake, like you are taking, you're in any other emergency. And I want you to think about it in that way. Do you plan for emergencies? Yes. In California, we do the shakeout because we prepare for earthquakes. When you're in Florida, we do annual drills in regards to hurricanes. When we're in the Northeast, we do drills in regards to the winter storms that they get and different kinds of things that they deal with there, a lot of flooding up there. So everywhere we go, we deal with various disasters. All COVID is a disaster. It's like anything else. The difference is it maybe has a longer life, and it's a lot more, the volume is turned up a lot more. But I don't want you to think of it as overwhelming. I don't want you to think of it as something that is going to end humanity. Instead, I want you to think about it as rationally as you can. And this cycle that you're seeing on your screen is the cycle I want you to follow, the same cycle that you would follow if you were to be sitting in front of me now saying to me, Patrick, what I want you to do is I want you to write an earthquake plan for us. I want you to write an active shooter plan for us. I want you to write a plan dealing with mass shooters or an active terrorism or whatever. Anything that I'm doing, this process you're seeing is the process you need to go through as well, beginning on top with planning. And we're going to talk about that, right? So, and then you're going to talk about training, how to train your staff, testing, meaning how are you going to drill and how do you know your plans work? And I'm going to talk to you about that, because if your plans haven't gone through even the most basic kind of testing, how do we know it's going to work in the long run? Then the actual disaster itself, I consider that part of the cycle, in particular how you respond. And then that green arrow, the purple arrow, I really want you to look at, because everything here has to be improved. Your planning has to improve, your training has to improve, every element of what you're doing has to continually improve. So let's talk about the first element, which is the response plan. A lot of you are involved in this now. This is what I contemporarily hear from clients and from other people as, this is our disaster plan. And this is what you're doing right now, is activating the emergency response. So let's talk about it. Your response plan, for it to be an effective pandemic plan, needs to have a number of elements in it. The first is really what we call supplemental plans. One of the things that your pandemic plan has to have in it, and this is going to seem very odd to you, but it really has to be in it. You have to have a plan in there for not only dealing with quarantine, you have to keep a plan in there for how to evacuate the property. If it's getting to the point where if this turns into something larger than we expect, then you can't be put in a position where you're not prepared to evacuate off the property. And I know a lot of you are shaking your heads going, there's never a situation when I would evacuate the property. And I can give you example after example in other disasters. When we dealt with swine flu, when I was in the UK, I was in England at the time, There were times where they were turning the property saying you have to evacuate, and they would say that's ridiculous. They'd say, well, whether you think it's ridiculous or not is irrelevant. You have to leave because it's too dangerous for you to be here. Other pandemics that are ones that really haven't occurred in our lifetime, like the Spanish flu, what happened with the Spanish flu, if that had happened today, or if COVID for some reason gets to be much larger than it is now, there will be evacuations, and they will require evacuations out of certain areas. The second part of your response plan is crisis communication. And I'm going to spend a minute or two talking about this, because one of the things I hear all the time from properties, from management, from owners, from franchise groups, from property owners, is they say, well, I've been doing this, Patrick, for 10, 20, 30, 40 years. I know what needs to be said to the media. I know what needs to be said to guests. I know what needs to be said to these folks. And we are finding time and again that really isn't the case. All it takes, literally, and I'm not being funny about this, all it takes is one guest of yours, one guest, not 2, not 5, not 10. All it would take is one guest from your hotel to walk into an emergency room and say to them, I have symptoms of a coronavirus, and tell them that. If a news reporter, if a journalist, anyone hears that, you have no idea what is going to happen to your property. It is going to be inundated with the media. It is going to be inundated with people coming there. It is going to be a massive response, and it's going to change the way you do things. And I'm just going to say this because I want you to be put in the right kind of footing where if that occurs, you are not going to have time. You are not going to have time to be able to formulate the proper responses. If you don't have proper crisis communication, you need to know how to deal with the media, know how to deal with the public. I can guarantee you, because I've been working with all different kinds of businesses, amusement parks and RV industry and restaurants and bars and all different ones. And what happens is that the minute that somebody tells someone, well, I was just recently staying at this place, or I was patronizing this place, that becomes a madhouse because the media is all over that. Dealing with events. At some point, this is going to start to let up. No matter what you hear in the media, no matter what you hear, at some point, they're going to start alleviating lockdown plans, including the ones in Michigan. So for those of you who work with properties or know people who work with properties in Michigan will realize that if you think it's bad in California, that's nothing. This is nothing compared to what's going on in Michigan, where you can't literally go out of your home and the police can stop you. I mean, it's incredible. So the lockdown orders are very strict. The quarantine orders are very strict. When you have events on your property of any kind, so, for specifically with like civic groups, I mean, if you have things like Rotary meets on your property or Toastmasters International or Kiwanis clubs or whatever, these are events. Does your disaster plan have to specifically discuss those events? Yes, they do. It shouldn't just be, well, if we decide we don't want to have them here, we're going to tell them to leave. That doesn't work. You need to have a specific plan for what you're going to do with the events, how you're going to deal with it. Are you going to continue to have it? Because the pandemic could go either way. We really don't know right now. Supplies and equipment, that's obviously a huge deal. One of the things that you do have to do is you're going to have to modify your PAR levels. And I was telling this to healthcare facilities too, because I do a lot of work with healthcare and senior care facilities. About the 1,400 that I work with, I was telling them, the PAR levels that you have for 10 days ain't going to cut it. And you know that by now. So instead of it being 10 days, it's going to be 30 days or more, because if you don't do that stuff and you run out of equipment, you are going to be held accountable for it. And you'd be amazed at how fast that stuff can go. And you guys understand this. Environmental cleaning, that's not something I really need to talk about too much with you guys, because you understand that. However, there are some questions I do get from properties who ask me about the environmental cleaning that goes on with airlines, because they were hearing about Delta Airlines using a particular type of sanitation chemical, ones that are EPA warranted and this and that. And there are ones that are specific for COVID. There are ones that you use that are industrial strength kinds of cleaners that are specific for biohazard kind of responses. Those are fine. But if you're going to implement them in your plan, you have to know how to use them. I had a property that was using one called Virox. You probably haven't heard that before. It's hospital grade stuff. and I was watching them, they were using it incorrectly. And as a result, I told them, you paid a lot of money for that thing, and that's not helping you at all, because they actually had a couple of rooms that had gotten compromised and they were using it. And I told them, I said, you got to learn how to use this stuff. You have to have a response plan for dealing with common areas too, dealing with pools, dealing with all these things. With that, some of you guys have like, fitness centers and you have spas, and some of you guys have like massage things. Do you have to have disaster plans that cover them? Yes. As a matter of fact, when I was at a B&B over Christmas time, they had like, downstairs, they had an entire place where you could get massaged, and they had steam rooms and everything else. Does your plan need to talk about what's going to occur with those common areas? Yes, it does. It needs to be very specific. When do we open them? How do we open them? Under what conditions do we open them? Do we create additional rules and conditionalities where we would never allow them to be open? And there are properties where we've written plans where literally they set an extremely high bar for when they would reopen those areas. And as you guys know, in California, county by county, that will change. It's not statewide. Every county has its own rules, and you have to abide by those. Incident command is the last one, and I put that as last, but really it should have been first, because when you are activating an emergency response plan, you have to put people in charge, and you guys understand that already. But the trap that I am finding a lot of properties are getting into is that they simply say to me, well, management will handle the entire response. Well, I'm just going to tell you, you can do that. That sounds fine, but study after study after study and experience after experience after experience tells us that not only does that not work, it's actually counterproductive, and it decreases morale on the property, because there may be instances where your employees have to make decisions without you being there. It doesn't mean they're making widespread choices on things, of course not. But there are things that they may have to do on their own, and you have to make sure that even if you're empowering them now, even if you're saying at the screen, well, I already empower these people, I already gave them this authority, I'm clearly not there all day long, so I can't do everything, that's fine. But there are other elements, and we don't have time to get into it now, of things you need to empower them to do. Element number 2 is recovery and business continuity. I have yet to, in my career, and I've worked with hundreds of properties from coast to coast, I have yet to see a business continuity plan that really met the best practices and standards of our industry, because there's a lot of elements to business continuity that I want you to think about. The first is operational recovery, which literally is getting us back in business. And some of you are saying, well, I'm already in business now. Well, that's true, but there are elements of what you are doing that are not recoverable. For example, your pools may be closed, right? So does that mean that is that recoverable? Yes, it probably is, of course, but when, we don't know. What about things like event rooms? I'm just going to tell you now, regardless of what anyone thinks, the counties and the state is going to create rules for who's allowed in those event areas. What is the maximum number of people you're allowed in there? Are you going to have to put 6 feet between chairs? You might. You absolutely might. Is that going to have an effect on your business? Absolutely. And there's a lot of other elements to the way you guys have combined properties. I've seen properties who are adjacent to beaches. Are you going to have controls on those? I have a hotel I visit almost once a year. It's on the Central Coast, and their beach areas are literally roped off, and they actually have people who are jumping the ropes, and they literally have had to tell people, I have to set a security guard out here, because if you get caught, and if it's discovered that you are acting as a scofflaw and allowing your guests to do whatever, I can guarantee you they will put a stop to that in a hurry. Information technology is huge. One of the things that is very interesting is the fact that obviously people are now relying so much more on information technology. They're working from home, much like I am now. We have people who are using Zoom so much more often or GoToMeeting or whatever. Those two people who are hackers overseas, they're sheltered in place just like you. And they will hack into your systems. People are now we're seeing now a massive increase in the number of phishing scams. They are going up by hundreds of percents, not dozens of percents, hundreds of percents, because they know There's so many more people now who normally would work in an office, maybe even with a secured VPN or even a secured network, where they literally they have an encrypted wall where they don't even have to deal with external emails. I have colleagues of mine who actually work behind such a high external firewall. They're not actually allowed to view their emails until it is viewed by an information technology professional. So, I mean, and that's the way it is in our industry. So those are the kinds of things you have to think about. Do you have to work with people on dealing with IT? Sure. Yeah, those are things you have to put into place. The other element of your business continuity plan has to do with your people. And a lot of you have implemented this already, which I applaud you. Absolutely. That's great. You have policies regarding illnesses. Terrific. You have things dealing with sick days. I know that obviously the state of California has modified the way we're doing that now and the number of sick days they've asked you to offer. Dealing with payroll. I mean, one of the huge issues, I don't care what the industry is people are wondering about when are they going to get paid next? Making sure that there's continuity of pay. Are you going to furlough them? Are you giving them fewer hours? Those are things that can have a big effect. I'm going to talk about psychological in a moment, but if you look at the very bottom bullet point, this is something that I would like to highlight. So before we do anything else, I want to make sure that even if you had your ears plugged for the last 20 minutes or so, unplug them now. Because when you are dealing with sending people home, that needs to be written down. That is not something you do verbally. It is not something you do via email. It is something that you put on a piece of paper that is typed and printed and something that you literally have on the desk of the manager, because there are people who will not want to go home. We are already looking at people who are threatening to sue their employers because they are being sent home for arbitrary reasons, because, quote unquote, they look sick or they don't sound well. Well, there are certain kinds of businesses and certain employment contracts where that is not permitted. Where regardless of what that is for your property, I have no idea. But do you have to have a written process? Yes, you do, and I can't emphasize this enough. Type it, print it, and have it so that that every employee follows it. Every shift lead you have, your assistant managers, your property managers, make sure that if it goes through a corporate process, make sure your legal department has viewed it, but you need to have one in place, because if you send people home arbitrarily, I can guarantee you that is not only going to create a morale issue and a legal issue, it's also going to create an issue with other employees. So it's something that is much larger, and we're seeing this in many industries. So I'm not just emphasizing that for you. We work in 53 industries, and I'm doing webinars for lots of them. And one of the things that we're hearing time and again is what people are wondering about being sent home. The psychological element is something you have to think about as well as dealing with benefits and dealing with illnesses in the families and things. You have to realize, and you probably understand this also, it's probably occurring to you too, which is people are seeing significant psychological issues. People are traumatized because they are being self-isolated with families. I know this sounds weird, but I actually work with a number of people who, and I assume that they would enjoy working from home. I thought that they would enjoy a lot of that stuff. They do not. They do not want to be around their families. They turn and say, I love you, you're great, but I can't be around you all day long. I have to go to work, I got to do other things. So a lot of these non-essential staff members or people who can work from home, even though they would normally work on a property, they are going to have an effect as well. Obviously, staff members are your frontline people dealing with your guests. Those are folks who are going to be dealing with the way that people are reacting. There is one of the things that I'm seeing and hearing about anecdotally on properties is they are noticing there is a significant amount of alcohol that is being brought onto their properties and into their rooms. People are seeing guests, but we're bringing in cases of beer, and there's extra wine being bought. And now that with the stimulus checks coming in, they're talking about people buying food. I mean, for those of you who recall after Hurricane Katrina, FEMA was giving out $2,000 debit cards. Later on, they found studies that said that a lot of that money was being spent on alcohol. People were literally buying alcohol because that is comfortable for them. Does that create a management problem on the property? The answer is an unequivocal yes. Your guests are going to be stressed. If you have vulnerable populations there, that's going to be an issue. I used to be a medic in Los Angeles. So for those of you who are hosting responders and people who are traveling nurses and things, Are they going to be dealing with psychological issues? Yeah, they're going to. These people are working literally 16-hour days. I mean, when I worked hurricanes, I was working 16, 17-hour days. One time, I almost collapsed on the job because I'd forgotten to eat. It had been 13 hours since I'd had a meal, and I was going patient to patient to patient to patient to patient, and I forgot. And what happened was, psychologically, I began to break down over time because I wasn't eating properly, I wasn't sleeping properly, I was clearly nervous. And you can imagine the people who are being housed on your properties right now are people who may be dealing with on a daily basis. They are afraid that they are going to get COVID. So on top of the issue of family finances, and people are worried about what's going to happen, in the long run, and they're getting a lot of misinformation. So there's a lot of things that you have to think about there. So, okay, so let's talk about element number 3, which is what are you going to do really? What should your pandemic plan talk about, or what should it deal with in relation to other disasters? Because just a few days ago, we were dealing with tornadoes in the South, and those tornadoes were buried in a lot of the news reports because COVID has taken over everything. But in California, the wildfires don't care that there is a massive pandemic going on. They do not care. If we have an earthquake tomorrow, that doesn't care that we're dealing with COVID. It doesn't matter if there's whatever is going on in the world. It doesn't make a difference. If there's flooding in Southern California, whatever, those are things that can happen concurrently with your COVID plan. And that becomes an important part of what you deal with post-disaster. Your overall management of the disaster, it needs to be discussed. I know a few of you anecdotally, I spoke to a few of our clients who are CHLA members, and they were telling us that managers were working 14, 15, 16-hour days. I hate to tell you this, folks, you can't keep that up. I don't care how long you've been doing this job. I don't know, it doesn't matter. You're going to get to a point where you're not going to be able to continue to do that. So you need to put yourself in a position where if you are dealing with COVID and then you have another disaster at the exact same time, you are going to be in a position where you can't do both. I know you want to do both, but you cannot do both. You are going to have to put other people in charge. Other people are going to have to do things. And hey, I'm a CEO, so I feel you. I understand that entirely. I run 2 companies. So there are times where I'm dealing with one business and I literally have to hand off my responsibilities to somebody else dealing with my other company, because I'm like, whatever I'm dealing with, I can't effectively do both. So one of the things I want you to think about is, if you have a couple disasters occurring at the same time, how are you going to manage that? Your plan, does it need to specifically talk about how you will deal with COVID plus another disaster? Yes, it does. So just because you have a plan, which you've dusted off today, and it has a whole thing on earthquakes, and you're like, whoa, I haven't touched my earthquake plan in a year and a half, but you know what? I think it's totally fine. That's okay. But it also needs to cover what you're going to do if COVID-19 occurs at the same time, because I'm just going to let you know now, I've been in these disasters. I have been in massive, large-scale emergencies. There are things that they are not going to make exceptions for. So if you have a disaster, some parts of social distancing may be let up, but there are other things that may not. We do not know. Anderson Cooper does not know. Kim Kardashian does not know. Nobody knows. But does your plan need to start discussing this stuff? Unequivocally, yes, it does. So one of the things that I see that really good properties forget to do all the time, this happens constantly, and I don't want you to fall into this trap, is what's called an after-action report. An after-action report is so important because, as I was emphasizing to you at the very beginning of this, is COVID is unprecedented in scope, size, and the impact on the psychological elements of our communities. Because, I mean, hey, look, if you live in the tornado belt and you have a tornado, yeah, it's terrible, of course, and you're going to deal with trauma, especially if you see a loved one getting hurt or killed. That is going to have an effect on you. But that doesn't change the fundamental character of your community. Even in large-scale disasters, and I've been to, I've been to places. I mean, I've lived in New Orleans, and I know that Katrina is still on people's mind, but I mean, it doesn't affect the way people live day to day. That doesn't have any effect on that. I mean, so they certainly think about it, but they don't, but nobody says, well, because of Hurricane Katrina, I don't go to the grocery store on a Tuesday, or I'm not going to go at 8 o'clock in the morning. I mean, nobody ever says that stuff. This is different. This changes you. And I will tell you, the only equivalent to this that I have ever seen is the way that this is impacting people is the same way a terrorist attack, especially a large-scale one, affects communities, especially ones where they're involving chemical responses or biological responses. So one of the things I want you to do with all that prep in mind, this is what I would like you to make sure that you do on your property. You need to write an after-action report. That is unequivocal. I don't care how large you are. I don't care how small you are. I don't care if you have 2 staff members or 300 or 400 or 1,000 or 2,000. You need to write a full after-action report. So how do you do it anyway? Well, the first thing you need to do is you need to think psychologically and make sure you're talking to your employees about, how has this affected you? How are you guys dealing with this? Not only as employees of my property, but how are you dealing with this as a husband or a wife or or as a father or whatever, any of those elements, because that is how deep this disaster is impacting people. So you do need to talk about that. You do need to be empathetic about it. I have a great manager I work with down in San Diego. He's fantastic, but when he was doing some of his debriefings, when he was talking to some people who were leaving the company, independent of COVID, he did everything right. He did all the questions and everything, but then he forgot to empathize with them. He just said, oh, great, okay, that's the way this is going to go. I wanted to hear what this way worked and that worked, and then he forgot to say, how are you doing? How is your family doing? How's your kids doing? Things like that. And those are things that become really important. The next thing is what we call stress debriefings. You do need to do this from time to time, especially with employees who are going to be leaving you. Obviously, there's high turnover in this industry. I totally understand that. So the debriefings are important from time to time, especially since this is going to be a large-scale disaster. Well, what does that really mean? Well, we'll talk about that in just a second. But your stress debriefings, you do need to hold them periodically, not meetings where you're doing your normal management spiels. You're talking about this, talking about the operations. No, I'm talking about you're putting your staff in a room and saying, how are you guys doing? Well, I'm fine. No. How are you really doing? How is your family doing? I care about you. I mean that. And if your manager isn't up to that, if that's somebody who tends to be somebody who, their personality doesn't really lend themselves to that, that's fine. Get somebody else. Get an assistant manager. Get somebody who can really empathize with employees. And you guys understand your properties very well. So there's always that one person. There's always that one person, no matter what department, whether they're in housekeeping or whether they're in maintenance or whatever, there's always that one person who's really good, and people who work there respect and love that person. That's the person that needs to be doing those stress debriefings and talking with them. It's not psychological, you don't have to, implement these big psychological terms, and you don't have to implement these large stratagems and stuff. But what it does mean is that you're implementing and talking with people throughout it. Then here's the big one. This is where you win or lose the game. It's called lessons learned. Your after-action reports need to discuss what went well and what did not go well. So that's what you have to talk about with people. So when you have your after-action meeting, you need to sit everybody down in a room and you need to say, okay, guys, what did we do well and what do we need to work on? It's as simple as that. And I've been doing this a long time. I'm FEMA certified. I've done exercises big and small, coast to coast. I've done them with hospitals and nursing homes and large charter schools and public districts, all kinds of things. Every single time I ask those 2 questions. What did we do well and what can we work on? Not how did we fail, not we didn't do good on this stuff or what didn't do well. I actually had somebody who said, well, what sucked about this response? Okay, well, that sounds fine to say colloquially, but you don't say that in front of staff members, right? So you want to simply make it like, hey guys, we did some things really well and here's some things to work on, because those are lessons you've got to put together. You've got to ask everyone. The other thing I'm going to say before I talk about concurrent emergencies is this. That lessons learned briefing, so it's different than the psychological first aid meeting or the stress debriefings. The lessons learned meeting needs to be run by someone who is not traditionally in management, and preferably someone that does not work for you, because there are going to be things that employees will need to be able to say that will be perceived, especially if you are like, I'm running this response, I run this for my property, I do this thing. That's totally fine. But then you need to have somebody from the outside who does not know your people, they don't know them, and segregate your employees and sit down with them one group at a time and say, what did management do well and what did management not do so well? And the reason is because I can't tell you the number of times where employees will not speak up. They will not speak up if they think that it's management talking, because if they criticize you, you know what they're going to feel like that you are going to do to them? You're going to fire them, or you're going to get angry at them. Even when I do after action reports in my own company, like I don't do them. I have somebody else doing the lessons learned for whatever reason, because I don't want people thinking that I want them to be reticent. I don't really care. What I want is good information from my people. And your after action reports have to be clear and determined. And for those of you who want to reach out to me, I'm happy to provide you with a basic template for an after action report. So I'm happy to help you out in any way I can. Concurrent emergencies, like I said, if you have an act of terrorism, if you have a natural disaster, what if we have the wide-scale power outages again? Okay, is that going to have an effect on things? Sure. And your plan has to talk about all those things if you're going to be effective in the long run. So the next couple things is training. The first thing is that, yes, we're in the middle of the COVID response. Yes, but does that mean that we can't train people? No, it means you must train people. As you learn things, you need to write everything down. Then you need to train everyone on those things. After this COVID response is over, when you do your after action report, do you need to retrain your employees? Yes, you do. Don't wing it. Don't say, well, we'll just figure it out. I can't tell you the number of really competent, really great managers, well-educated, been in this industry a long time, that tell me time and again, well, we'll just figure it out. I go, why would you do that? Like, why would you? This is a wonderful opportunity to learn from this stuff and train so that the effort you put out now, next time you're not going to have to do that. Or if this thing spikes again, you're going to really have to reinvent the wheel again and again and again and again. Why do that? So get a really good training program in place where people understand how your COVID response is going to go. If you hire new employees from this moment on, you're going to have to train people on your COVID response. There is no ifs, ands, or buts about that. You're going to have to do that. In fact, I wouldn't be surprised if certain counties and certain states require pandemics in place, because 100% of the employees have to be trained. If you don't train people, folks, plans simply is not going to work. You have to train people. There is a way to do it. We don't have time today to go into all that, but I will say this: the training regime has to be regular, it has to be often, and it has to incorporate the new lessons that you are implementing week after week and month after month. Because if you're not implementing the training, you know what's going to happen? Eventually, middle management's going to turn over. Line employees are going to turn over. I have hotels and properties I work with where, they have a turnover rate of almost 100%. So, they have large numbers of people coming in and out. That means your training regime needs to be robust. Yes, you need to talk about it the same way you talk to them about, doing direct deposits and doing benefits and orienting to the properties. So those are all things that become really important. So a couple things, and then we're going to move on to the very last element, and then I'll be happy to take some questions for a few minutes if there are any. Your training plan needs to talk to your staff about vulnerable guests. I know a few of you have told me, and some of you and some clients that we're working with both in Northern California and Southern have vulnerable guests there, people who are elderly, people who have newborns, people who are in healthcare, people who are dealing with, people who are, under risk on a daily basis. If you're going to have that stuff, even guests who are pregnant. Anytime you have those, you need to train people. You need to think about how you are going to conduct operations with the vulnerable guests there. They need to be trained how to deal with them. I can guarantee you, as the day is long, that you are going to be facing customer service challenges that you've never faced in the past. Guests are going to get irate a lot faster. Your service sequencing is going to have to immediately change. The way that you are dealing with guests who are stressed and agitated, any training you may have been doing before, it's not even going to come close to deal with the types of challenges you're going to have now. Your training plan, I know this is going to sound silly, but you really do need to do this. You need to turn to your employees and say, look, you need to have a personal disaster plan. In other disasters, you can get away with not doing it, right? Because there's wildfires that don't affect everybody. You have earthquakes that may not affect everybody, whatever. But this affects everybody. You need to tell them it is your responsibility to get a personal disaster plan, period, unequivocal, full stop. You need to train people on the recovery element of as well. And that's not only just because you need to train them on, hey, we're going to be recovering and opening up the communal areas, but also you need to tell them, just like Jessica was saying in the very beginning, people need to see there is a light at the end of the tunnel. They need to see that there is a way to return to normal. These are things that become really important. And then lastly, you can't forget to train people on the other things that you do, the other threats you face. You know, I have a property that is right on the beach in Eureka, California, or, you know, like right on the coast near Eureka, California. Unbelievable. And I asked them, are you training on COVID? Oh, yeah. Are you training earthquakes? Oh, yeah. Are you training on this? Oh, yeah. I said, how about tsunamis? They're like, whoa, what? I'm not training on tsunamis tomorrow. I said, well, you could have a tsunami tomorrow. That could happen. So you have to keep training people on those things. I know it sounds like a bit of an exaggeration, but ultimately that's the way you're going to do it. That's the only way you're going to be effective. Last element here is drills and improvement. You do need to prepare, and it doesn't make any difference to me where you may have read things, where you are getting your current information from about COVID. Some people I talk to say, well, I have a particular news source, or I have somebody I trust, or I go on the CDC's website, or I go on public health, or I go on World Health Organization. Oh, well, fine. Oh, great. Whatever works for you. But the one thing I will say is nobody, and I've been on calls with Homeland Security. I'm on the Infrastructure Protection Program. So I get briefings. We do the weekly calls, all that other stuff. I will tell you this right now. Nobody knows if this is going to reoccur or not. We do not know that. That is not for sure. We do not know. We do not know if this is going to be a spike. We do not know if this is going to become seasonal. This is what I've been telling people, though, over the last couple of weeks. I've been doing webinars a lot. The next 6 weeks will tell us what will happen over the next 6 months. That's the way you need to think about it. So the information you're getting today and tomorrow, well, whatever. In 6 weeks, we will begin to know whether or not this is going to be something over the next 6 months. And I didn't say 6 years, but one thing is that over the next, series of months, we're going to see whether or not this is going to be something that's going to be a quote unquote new normal, or if it's not something that's going to be separate from that. The other thing you need to do too is you need to think about the tempo of the property. I know people who are working days and nights. You have employees that are doing lots of stuff. That's all great. The tempo cannot be at that pace all the time. So you need to continue to have ups and downs, and you need to slow down the property a little bit. I have a property I work with up north who I've already told them you need to slow down what's happening here a little bit. You don't need to be. I was walking the property. I saw employees like running around trying to get things done. They had a bunch of like visiting nurses there, and I said to them, you can't be doing this. You can't be doing this. You have to slow down the property. And they go, well, that's the only way it's going to get done. Well, if that's the way it's getting done, that means you're not improving. It means you're not getting better. You're not planning properly. And you've got to update your plans. You have to update your plans. I will tell you this. I say this as a joke, when I talk about my employees, which is when my employees go on a site, I tell them, I say, I want you to run a little test. And they go, oh, so what do you want me to do? I said, I want you to take the disaster binder off the shelf, and I want you to run your finger across the very top of it. And you know why? Because it's called the dust test. Because I want to see if anyone's ever opened that silly plan and when it was last opened. Do you need to update your other plans? Yes. Does your COVID disaster plan need to be updated? Yeah, it does, actually. It needs to be updated on however often you want to do it. We say it should be done every 2 to 3 days. I know that sounds strange, but it really does. It has to be updated continuously because this is going to change. Over the next 6 months, we're going to see a massive amount of information coming out. We will know whether or not this is going to be something that is going to be longer term. Your plans also need to talk about what you're going to do over the next year. Financially, you need to talk about what you're going to be doing on that element of the recovery. You also have to think about what's going to happen when guests begin to leave. This is the critical time period, though. The next 18 months, we will know if there's going to be a vaccine. The next 18 months, we will know how this is transmitted, most likely. The next 18 months, we will know whether this is going to be seasonal or not. The next 18 months, we will know what the quote-unquote new normal really is going to be. So I don't want you guys to be doom and gloom, but I don't want you to be Pollyanna. I want you to be the middle, which is I want you to look at things strategically, view the right kinds of information, but realize that information is coming in continuously, but your property has to continue to adapt to that stuff. Because you know what? The day an employee of yours gets sick from COVID, that is going to change the way your entire workforce operates. Literally, overnight, it will change the way you do things. So you have to make sure that you have plans in places for communication and dealing with benefits and dealing with people leaving and sending people home and dealing with the IT elements of it. These are all parts of your larger scale plans. And then your pandemic plans need to go out to 18 to 24 months and 24 plus, because I don't know how many of you saw the news this morning. Research came out of Harvard University. So we're not talking about some random university. It came out of Harvard, and it was published in the journal Science, which is a very distinguished journal. And the one thing they said was, it is very possible that social distancing will need to be implemented through, they didn't say end, they said through the year 2022. That is significant. If that is correct, that is going to have a massive impact on the way you do things. So your plans have to cover all of those things. So today, one of the things I tried to cover as best I could, the elements of response and recovery and dealing with post-disaster and the training. But just don't forget also, continually drill, continually run updates, continue to improve your plans, because if you don't, you're going to have a pandemic plan that seems like it's effective until you're dealing with the very next emergency that could be right around the corner. And so from there, I will hand it back to Jessica Counts. Thank you, Jessica.
All right, great. Thank you, Patrick. A lot of great information there. And just want to reiterate, if anybody does have any questions, I haven't seen any trickle in just yet, but please go ahead and utilize the toolbar that's available there, where you can go ahead and type in your questions, and we can go ahead and reference those for you. And in the meantime, I'll just make a couple notes here. You can refer to calodging.com on our homepage, and you'll find CHLA's coronavirus updates and resources section that is updated daily. And this is where we will post today's presentation. And also to keep in mind, we do have a few other upcoming webinars in addition, including CHLA's COVID-19 biweekly update, how to prep your property for the best year yet, working from home ergonomics, and more. So that's something, please stay tuned on that. Still checking back here. I don't see, any questions at this time. Patrick, if you had any additional comments, or we can conclude it here.
Sure. Yeah. The other thing I was going to talk to you guys about too is making sure that if you're going to get information on the latest updates, if you're looking for things like, for example, I get a lot of questions from property owners about, well, how do they want us to handle the distancing issue, or dealing with a meeting, or dealing with this, or dealing with that? I can't tell you how important it is for you to be checking the county's public health websites. So for those of you who are actively doing that, I give you a round of applause. If you're not, make that in your workflow. That should be the first thing you do in the morning. That's before you do anything else. Before you, start to set that up for the day, before you start to do anything. If you work from home, that is the first thing that you should do, is check your public health department, because they will come out with things, and sometimes it's very irregular. So those are things that can change on a on a daily basis. So those are that is guidance that can absolutely change for you. So I want you to make sure that you're constantly reviewing that site, reviewing the guidance, and then if you're working with a corporate entity, make sure that you are relaying that information to them, because if they're telling you, if corporate's telling you to do one thing, they may be basing that based on a general risk guidance. And I know national companies and chains that I work with all the time who say, well, we'll give the national guidance to our franchisees, or we'll give them to our properties. That's fine. But as a property person, you need to make sure that you are establishing that dialogue with them. So if they decide they're going to develop the guidance entirely, that's totally fine. But you need to tell them, please review what the county says, because I will tell you this right now. California is, the counties are getting really strict about things. Just this afternoon, for example, I was just pulling up a few sites, and I was reading guidance that was coming out of the Sacramento Police Department and the sheriff's departments, that they are now going to where before they said they would not arrest anybody for violating quarantine orders. Now they have changed that, and the sheriff signed an order, I believe, that they will now arrest you if people are violating these orders, if they're not doing what they're supposed to be doing. So, for example, on your properties, if people are hosting large parties, that is illegal. And those are things that can get you in trouble. And think also about the industry as a whole, because you don't want to get into a position where if you have a property that's constantly violating the rules in the county, if that gets in the newspaper, or that gets on Facebook, or that gets on some news site, and it will, I guarantee you, then what's going to happen is the county will crack down on you, and the county will crack down on everybody, and that's not what anybody wants. So the attitude I have for it is just put yourselves in a position of being positive. So taking the time and doing the adequate kinds of planning and things. And so I think if you're constantly evolving the plans and putting yourself in a position to be successful, I don't see any reason why your pandemic plans for COVID can't work. So Jessica, I'll hand it back to you.
All right. Thank you, Patrick. And thank you so much for presenting for us today. Really appreciate it. I know we covered a lot of information, and those of you that, you may think of a question, down the road, please reach out to Patrick with his contact information here that's available for you. Other than that, thank you for listening in, and we will go ahead and conclude today's presentation. Thank you so much.